Urinary incontinence. Definition: urinary incontinence, also known as involuntary urination, is any leakage of urine. It is a common and distressing problem which may have a large impact on quality of urine. Urinary incontinence is often a result of an underlying medical condition but is underreported to medical practitioners. Urinary incontinence, the loss of bladder control, is a common and often embarrassing problem. The severity ranges from occasionally leaking urine when you have cough or sneeze to having an urge to urinate that's so sudden and strong you don't get to toilet in time. Symptoms: some people experience occasional minor leaks of urine. Others wet their clothes frequently. Stress incontinence. Urine leaks when you exert pressure on your bladder by coughing, sneezing, laughing, exercising, or lifting something heavy. Urge incontinence. You have a sudden intense urge to urinate followed by an involuntary loss of urine. You may need to urinate often, including throughout the ride. Urge incontinence may be caused by a minor condition, such as infection, or a more severe condition such as neurological disorder or diabetes. Causes: urinary incontinence is not a disease, it's a symptom. It can be caused by everyday habits, underlying medical conditions, or physical problems. A thorough evaluation by your doctor can help determine what's behind your incontinence. Overflow incontinence. You experience frequent or constant dribbling of urine due to a bladder that doesn't empty completely. Functional incontinence. A physical or mental impairment keeps you from making it to the toilet in time. For example, if you have severe arthritis, you may not be able to unbutton your pants quickly enough. Mixed incontinence. You experience more than one type of urinary incontinence. Temporary urinary incontinence. Certain drinks, foods, and medications can act as diuretic, stimulating your bladder and increasing your volume of urine. They include alcohol, caffeine, decaffeinated tea and coffee, carbonated drinks, artificial sweeteners, corn syrup, food that are high in spice, sugar, or acid, especially citrus fruits, heart and blood pressure medications, sedatives and muscle relaxants, large doses of vitamins B or C. Urinary incontinence also may be caused by an easily treatable medical condition such as urinary tract infection. Infections can irritate your bladder, causing you to have strong urges to urinate and sometimes incontinence. Constipation. The rectum is located near the bladder and shares many of the same nerves. Hard, compacted stool in your rectum causes these nerves to be overactive and increase urinary frequency. Persistent urinary incontinence. Pregnancy. Hormonal changes and the increased weight of the uterus can lead to stress incontinence. Childbirth. Vaginal delivery can weaken muscles needed for bladder control and also damage bladder nerves and supportive tissues, leading to a dropped pelvic floor. With prolapse, the bladder, uterus, rectum, or small intestine can get pushed down the usual position and protrude into the vagina. Such protrusions can be associated with incontinence. Changes with age. Aging of the bladder muscle can decrease the bladder's capacity to store urine. Menopause. After menopause, women produce less estrogen, a hormone that helps the lining of the bladder and urethra healthy. Deterioration of these tissues can aggravate incontinence. Hysterectomy. In women, the bladders and uterus are supported by many of the same muscles and ligaments. Any surgery that involves a woman's reproductive system, include removal of the uterus, may damage the supporting pelvis floor muscles, which can lead to incontinence. Enlarged prostate. Especially in older men, incontinence often stems from enlargement of the prostate gland, a condition known as benign prostatic hyperplasia. Prostate cancer. In men, stress incontinence or urge incontinence can be associated with untreated prostate cancer, but more often, incontinence is a side effect of treatments for prostate cancer. Obstruction. A tumor anywhere along with your urinary tract can block the normal flow of urine, leading to overflow incontinence. Urinary stones, hard, stone-like masses that form in the bladder sometimes cause urine leakage. Neurological disorders. Multiple sclerosis, Parkinson's disease, stroke, a brain tumor or a spinal injury can interfere with nerve signals involved in bladder control, causing urinary incontinence. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you. For more information, watch part 2.